Hi, you're listening to It Happened to Me, a rare disease and medical challenges podcast. The mission of our podcast is to support you, our listeners, and to create community as you confront the toughest challenges in life. All of us will experience health hardships. The real question is how we adapt. That's the focus of It Happened to Me, which wants to help you overcome limitations and live a full and satisfying life. Drawing on their own health challenges, co-hosts Kathy Gildenhorn and Beth Glassman interview guests who share stories and research to help you succeed in the face of difficult health obstacles. It happened to me. I'm not alone, and neither are you.
Today's episode explores life with chronic pain, the kind that alters every aspect of daily living and often leaves people feeling misunderstood and out of options. We're honored to welcome Meredith Mangold, an inflammatory bowel disease and chronic pain patient advocate. Her journey took her from the ICU as a college student to years of being bedbound with debilitating pain. Meredith lives with ulcerative colitis and complex chronic and pelvic pain, alongside multiple medical conditions.
After years of invasive treatments, medication trials, and medical trauma, Meredith found a new path through a personalized, multiple disciplinary approach to pain management, one that helped her back to her life that she once thought was over. In this episode, Meredith shares the reality of living with chronic pain, the psychological toll of long diagnostic journey, and what it means to move from surviving to slowly rebuilding and purpose of life. I want to disclose that I've known Meredith her entire life, and I am so proud and honored that she is with us today. She is a strong, smart, and extremely likable young woman. Meredith, welcome to the program.
Thank you so much for having me, Beth and Kathy. And yes, I wouldn't exist if not for you, Beth, because my parents met through you. So thank you for my life. I appreciate it.
Very true. Meredith's parents met at my wedding. They actually were both in my wedding, and Meredith's mom was my best friend in school. So it's a very close and important relationship that we have. So Meredith, let's start at the beginning and let's go back to 2011, and you're in college and you end up in the hospital. What happened?
Well, to preface things, I was relatively healthy growing up. I have had chronic migraine all my life, got that from my dad. And then I had really severe seasonal allergies. I was the kid who stayed in the library during recess and didn't go outside. And I was born with a genetic condition called alpha-1 antitrypsin deficiency, which can impact the lungs and the liver. But thankfully, they followed me through childhood, and it's been largely asymptomatic for most of my life. So when everything changed my sophomore year when I was in Georgetown, it was totally unexpected. I had no GI symptoms or anything, and my life changed in an instant. It was my sophomore year in the spring. It was February. I was studying for my midterms, and all of a sudden, I found myself running to the bathroom. Naturally, that year I was living in a dorm that had a communal bathroom. So I was in my dorm room studying, and then I was like, oh, and I had to run to the bathroom. I had blood in my stool, no idea what was going on. And so I went to see my primary care provider, and she said, you need to go to the hospital right now. And luckily, I grew up here in the suburbs of Maryland, close to Georgetown and DC. So my parents were nearby, which I'm so thankful for. And that was a whole complex dynamic, which I'm sure we can talk about later, which, I'm 20 years old, trying to become my adult self and having to rely on my parents again was really unexpected. derailed my development at that age. But yeah, my memory starts to get a little hazy because I think my brain was trying to protect me. But the primary care doctor told me to go to the hospital. We went down to suburban hospital right down the street and went into the ED. They took a CT, I think, and they saw that my intestines were just incredibly inflamed. And they said, okay, you need to go to Georgetown Hospital. So right back to my home base. And I remember we had to wait hours though in the suburban ED for the ambulance to arrive because my parents couldn't take me because they had already given me fluids and pain medication. So I had to wait for like official transport. And that was when things started getting a little hazy, but the ambulance finally arrived. But I think the driver was from like Southern Maryland, and that's why we had to wait a while. And he didn't know where he was going. So my mom had to get in the passenger seat and like direct
Oh,
him.
Unbelievable.
So I don't quite remember what I felt like in the back of the ambulance, but I distinctly remember my mom in the passenger seat talking to the driver and me just going, okay, I hope I get there. And so I remember being wheeled in to the Georgetown ED, but then everything pretty much goes dark after that.
that's where Meredith, I saw you was at Georgetown, and you had something called toxic megacolon.
Hmm.
I've never heard of it, and I bet our listeners have never heard of it. Can you explain what that is, Meredith?
Sure. Doesn't that sound like some deranged superhero or something?
Yes, it sounds odd, but
Yes,
all medical terms sound odd to me.
they
So,
all do.
yes, yes.
Yeah, they did an emergency colonoscopy and they discovered that I had ulcerative colitis. And so that's an immune mediated disease where the immune system attacks the large intestine. Most people are more familiar with its what I call like sister disease, Crohn's disease, which can
Yep.
affect any part of the GI tract. And so the UC was to the level of toxic megacolon, which I wanted to give an official definition, is quote, severe life-threatening complication of ulcerative colitis or other forms of IBD, where the colon rapidly swells due to inflammation, severe pain, systemic toxicity, and potential rupture, requiring urgent medical care and often surgery to remove part or all of the colon. So I think I was on the verge of sepsis.
Oh boy.
Oh,
And yeah, I most of this time is just from what I've heard from my parents and other people. But so yeah, I was admitted. And I know I was scheduled to have emergency surgery, but one of the peds attendings, because luckily, even though I was 20, I was able to be on the peds floor because I had had a peds GI following me in childhood for that alpha-1 antitrypsin deficiency. And so um, they, so that attending, they were trying to figure out something that could at least like tone down the inflammation so that going into surgery would not be as, intense,
Painful.
or to
Yeah.
hopefully try and, make me not have to get surgery altogether. And so she came up with this idea of what, she called old school med that is a transplant anti-rejection medication, cyclosporin,
Mm.
which, kind of suppresses the immune system. And so literally, I think it was like the day before, maybe 2 days before I was scheduled for surgery, it finally controls the inflammation enough to get
Mm.
me to a more stable, pseudo-stable state. And so I was able to not get surgery at that point, at least. And so Georgetown Hospital became my home for almost 2 months as they
Yeah.
oh,
tried to get my symptoms under control, tried all sorts of immunosuppressants, lots of prednisone, steroids, pain meds. Nothing was helping. Only Dilaudid really could take the edge off. I actually went home on a PCA, which is a patient-controlled analgesia, which is basically like, in the hospital when patients are like clicking the button for pain meds, but at home. So I had a pump that was attached to an IV. And so I would administer pain medication intravenously for myself at home. So I had that for a while. So I had to withdraw from school that sophomore spring and my junior
Yeah.
spring. I'd stabilize as much as possible over the summer and then return to school in the fall, still on a lot of medications, including pain meds, which made my brain fog and ability to focus still really hard. But I was in pretty difficult classes. I was an Arabic major, and so it was a struggle. But I remember I had a home nurse come to my dorm and teach me how to do my first Humira injections. So it was a very interesting experience. I ultimately, so all of that was really my crash course in the difficulty and roller coaster of our healthcare system.
Yeah.
How, no one teaches you how to navigate it. I always say that I kind of have come to possess a degree that I never wanted to have in healthcare
Yes.
navigation
Yeah.
and self-advocacy, but it's taken me over 10 years to really fully build that like toolbox of self-advocacy tips and tricks. And yeah, but kind of as we were talking about a little bit before recording, there is one good thing that happened to me during all of this intense trauma, and that was I met my now husband, Ryan, and
Yes.
Wow.
who
Your knight in shining armor.
he
Literally. Yes.
he we had met 2 weeks before I got sick. We met, then it was spring break, so he went home to Alaska. I went into the hospital, and then I just remembered he appeared in my hospital room, and
Oh,
he's been by my side through surgeries and flares and hospitalizations and everything ever since. And so I really think that if I would do it all again, I would get sick all again to find him.
Those Alaska men, right?
that's it.
Yeah. And he OTC, so he
Yeah.
would come in his uniform, and
Yeah.
all the nurses would be like, "Oh, hey."
Was the heartthrob on the floor, no
That's
doubt
it.
about it.
That's
Yes.
it. Now, Meredith, speaking of surgeries, can you tell us about your experience with surgeries?
Sure. And as an IBD patient, this is something I'm very open about, talk about GI things. So I am very open. So, if you don't want to hear about guts and stuff, skip forward. But yeah, I had to take off all of my supposed to be senior year to get a total proctocolectomy. So that's where they remove the large intestine and the rectum. And
Okay.
so I had it was a two surgery process. So they removed everything, and then I had a temporary ileostomy for about 2 months. So most people are more aware of colostomy. So I
Yes.
had a bag, and that was a whole adjustment. And there's a lot of like misconceptions that it's such a horrible thing and oh my gosh, you have an ostomy, but it is so life-saving for so many people. My sister-in-law has one because she has Crohn's, and it has completely changed her life. She's able to hike, and so I just want to put that out there as an IBD advocate. Like it can truly, save your life. So just wanted to.
Yeah,
That's a very good point.
very
It's a
good.
good point. When we have interviewed someone, actually my Pilates teacher who had that done, and it really, something that you fight against, and then it turns out to be something that you so desperately need because it relieves pain, and that is so important. So thank you for putting that out there.
Yeah,
that's important, Meredith.
Yeah.
But Meredith, how would you describe the pain to someone who's never really experienced chronic pain?
Well, to preface that, my surgeon told me that I would have to come down halfway off my pain meds in order to actually get the surgery in the first place. Otherwise, he'd have to put me in a medically induced coma to deal with the pain. So that just speaks to like the level of pain.
Yeah.
I was in, so my mom, who is a lawyer, met Beth in law school.
Yeah.
She came up with a wean schedule for me, did it totally on my own. And that is another whole part of my journey that maybe we'll talk about later. So chronic pain has been a huge part of my health journey. I was kind of led to believe that the surgery would be fully curative and I could like go back to my life, which was not at all the case. After the surgeries for months and months, I was in so much pain, even more pain than I was before. But just to be clear, like I wasn't in the hospital, I was stable, so I needed to get that surgery. So I don't want to scare anyone, but I think I just got sick so fast, and my whole nervous system is still just, all I just say it's angry. My body is angry. It's like all on and kind of fight or flight mode. So pain, I found a letter, an email that I had sent to my surgeon probably 12 years ago now the other day.
Oh, wow.
And so this was after I saw like second, third, fourth opinions from other GIs, surgeons, and pain management doctors. And I just thought that I would read this selection. I told him, hopefully I don't cry.
No.
I've never had a good pain-free day since the surgeries. I'm always in some level of discomfort or pain. It feels like someone took a cheese grater to my guts, doused my insides with acid, and lit it on fire. Other times it's crampy or stabby or a million other descriptions. So to summarize, I'm basically just existing. Although it's much better than being in the hospital. I know I'll probably never feel like a normal person, but I feel like I can't live my life. I can never go out. I'm always in my PJs in bed. I don't have idealistic expectations, but I still feel like a sick person. I'm sorry.
And Meredith, you're how old at this point when you wrote that letter?
I was 21.
See, that shouldn't be. That
Yeah.
just shouldn't be,
be.
Meredith. It should not be. To our listening audience, I'm sure that when you have been to a doctor's appointment, they've asked you about your pain level, and they usually goes from 0 to 10. Meredith, you're talking about living somewhere between 8 and 10. So if her letter to her surgeon, if Meredith's letter to her surgeon didn't give you an idea of what this pain was like, then living with the number of 8 to 10 conveys what Meredith was struggling with. Can you talk about that, Meredith, this struggle of living with this kind of intense pain?
That is my least favorite question. Can you rate your pain on a scale of 0 to 10? My, 8 is someone else's 20.
Sure.
Sure. The smiley scale of, what your pain is like.
Yeah.
I found an amended, much more funny and realistic one and printed out and brought it to my surgery. I forget all the steps, but there were these really funny faces that were like, just all kind of looks like a horror mask. And I remember the last one was like, oh my gosh, I see Jesus coming for me.
Oh no.
I would point at those, and my mom and I laughed because, after so many, countless times I've been asked that question. So it's really hard. And so I find that it's better to describe what the pain feels like and how it impacts your quality of life and the impact on your ADL, your activities of daily living. A number can be super subjective, and so it's better to describe how it is impacting your life. Kind of for a frame of reference, I've had kidney stones 3 times over the past 4 years or so. And as the symptoms started, I just thought it was my normal pain. Yeah, until the time during the pandemic, I was in bed and I literally couldn't get out of bed that had gotten to that point. And so the EMTs had to come and get me out of bed and into the ambulance. And then then that time it was the pandemic, so Ryan couldn't come with me, but I didn't realize that, so they just put me in the back of the ambulance and closed the door, and I was all alone for that hospitalization.
You are an incredibly strong woman.
Very
you
strong.
are unbelievable.
Yeah, but it definitely impacted my sense of independence and identity, because I had intended to, study abroad, travel,
right,
and I couldn't even get out of my
bed
most days.
Get out of bed. I'm not sure that the listening audience heard that Meredith has a gift for language, right, Meredith? I mean, you can pick up languages, and so you were you were studying Arabic.
Yes.
And you plan to use that all over the world. And so this affected your life plan.
It did.
In a very profound way.
Yes, it definitely did. I still kind of think of Meredith 1.0 and still grieve that loss, which is a really normal thing when you have a chronic condition, is that grief period, and it never really ends.
Right.
But I still, I have realized Meredith 2.0 is pretty great. She has,
I would say so,
empathy and compassion. And even though my life path I had pictured for myself since I was 12 years old, I was one of those kids. My life is so different now, and it may not look like what I perceived as, prestigious and successful, but I've learned so much, and I think it's made me a better person.
That's a wonderful attitude.
Yes, it's a
Wonderful.
great attitude.
You were later diagnosed with a number of additional conditions. What were some of these diagnoses, and how did it feel to accumulate diagnoses over time? Did so many overlapping conditions make it harder for doctors to see the full picture of what was going on?
100%. And yeah, I say I have a smorgasbord of conditions, but a lot of us in the chronic illness community do. And so some of them were postural orthostatic tachycardia syndrome, POTS. That's a chronic disorder of the autonomic nervous system. So that leads to a lot of dizziness, brain fog, fatigue, heart palpitations, digestive issues, temperature regulation. So basically everything your autonomic nervous system is supposed to do, it doesn't. And I kind of sought out that diagnosis because I saw a friend of mine who had it, and I was like, I have a lot of those symptoms. But I was kind of led to believe by some people like, oh, you're fine. It's just because you're deconditioned from being bedbound. But I went and got tested, and there are very, very few healthcare providers who it's just now starting to become more well known because it has similar symptoms as long COVID. There are very few clinics and doctors who are versed in POTS. So a lot of people actually like fully faint if they stand up. So I did all the diagnostic tests, and they're like, yeah, you have pretty severe POTS.
Right.
And so that was also part of why I was bedbound.
Were there other moments where you felt so dismissed or misunderstood as you did with POTS? And was the medical system repeatedly guilty of this?
It definitely was. I also accumulated an Ehlers-Danlos syndrome diagnosis called EDS, and there are different kinds of it. I have hypermobile EDS, so it's a connective tissue disorder that can also lead to poor wound healing, easy bruising, chronic pain. So because of that, like you were asking before, it really made it, doctors, love doctors. They have saved my life.
Absolutely.
But a lot were like,
But they're
you have,
human.
yeah,
They're
we all are. But it's like you have this whole mess of things. It's probably just all of that intersection. So it definitely made it a lot harder to pinpoint any specific problems, like, fatigue. It's like, oh, all of those are part of all of my diagnoses. And so there was a lot of, we found really great doctors, but there definitely is a lot of dismissal and gaslighting and, oh, it's anxiety, or oh, you need to exercise.
And I found, at least with my syndrome, that it was very difficult to find doctors that looked at things globally about what was happening in your body, not just specifically.
Right. Yeah, that's why I love my care team now, because
Me too.
they really do, right? But it's so sad when you meet someone like that and you're like, you see me? Like, you understand that this is my whole life experience. So anyway, I'm glad that you found that as well.
Yes, yes, yes.
Well, Meredith, one thing that you're not is a quitter. You never stop trying, and you've done everything you can to help yourself. You went from opioids to ketamine to even a spinal cord stimulation. Can you talk about what this was like to cycle through these kinds of treatments and not really getting the results that you wanted?
It was really hard because, I tried all of the medications. They all have their side effects, especially with opiates. I'm so thankful that I never had any sort of psychological dependency. Just, chemically, my body and opiate receptors were used to that. So I just really have a lot of empathy for people who do have psychological dependency, because I just know how hard the physical aspect of it is. So yeah, I went through all the medications, even opiates didn't help. And so doctors, first I did a spinal cord stimulator. And, every time there's a new option, you're like, oh, is this going to be it? Or got it removed after 2 years. Then I got an intrathecal pain pump. So basically it's like the PCA, but it's implanted in my back. So I had a pump that the nurse would come and fill up with. I tried to do non-opiates because I did not want to go on opiates again for about 2 years, but that didn't help either. So I got that removed after 2 years. I did
Mm.
ketamine infusions. Those helped in the moment, but they never helped after the fact. And they're so prohibitively expensive, and at least at that time weren't covered by insurance. So I got some relief during, but it didn't help long term. So each time something doesn't work, you lose more and more hope. So, and you think, am I ever going to be able to live my life? And so it was really hard.
Sure.
Yeah. And
No,
I felt like I was never going to have any sort of fulfilling life ever again.
Oh,
and I have to say to our listening audience that in treating chronic pain, there are times where opiates are necessary. But then, Meredith, you talked about getting off of them, and you work with detox centers. I remember you doing this. Can you talk about that, going through detox, what that's like emotionally, physically?
It is, that's probably the most traumatic thing I've been through. And I don't even
Really?
remember all the times that I've been on and off, on and off. And all of that weaning has been just me and then my mom in the earlier days when I was trying to get off of it to get my surgeries. And so
Yep.
we did a really good job, weaned down, and then the withdrawal symptoms just got so bad that I needed help. So the psychiatrist I was seeing at the time, who had been the attending on the peds floor at Georgetown, I reached out to him and I was like, hey, this is impossible. I need to come down in order to get my surgery. Can you help me? And so he had a connection with a doctor who had started, I don't know if you know the Colmac clinics. It's kind of traditional drug
Yes.
abuse centers in this area. And so he reached out to Dr. Kolodner and was like, hey, I have this patient. She's not psychologically dependent. She needs a medical detox to get surgery. Can you help? And so I think, the first and only person that they've allowed to come in to just do the medical detox. So you have to go in and complete withdrawal, and then they administer Suboxone, or I took buprenorphine, which is the Suboxone without the binder. And then it's horrible because that blocks that blocks like your opiate receptors. So if you were to take opiates, it would just like bounce off. But I remember my mom and I went in for the intake the day before I was going to start, and we were in this little waiting room, and there was a guy on the couch next to us who was just writhing in pain and moaning,
Oh,
clearly going through like withdrawal, and we were just
yes.
terrified, like, is that going to be me
This
tomorrow?
says can be you.
And it was. It
Oh.
was horrible, and of course they were like, "Oh, you're such an interesting case. Let's see if we can get you
Yeah.
off this in like 3 days." And then
Oh,
I went into withdrawal from the buprenorphine, and it was a whole experience, but it helps me get the surgeries I needed. But then there were a bunch of other times I had to do it on my own because, I would get
mm.
surgeries, opiates, rinse, repeat. But I didn't sleep for like 5 days.
oh,
I remember just walking around my parents' house, going from couch to couch and bed to bed, and it was really rough. But I think I went into the surgery on that medication. But it's definitely a soapbox issue of mine. So, and the doctor I see now at Hopkins, like that's what she specializes in, is getting people off of opiates and onto like non-opiate treatments.
mhm.
And yeah, I love her so much, but there needs to be
Wow.
more programs like that.
But Meredith, again, I've got to say, you're incredibly strong, but you have been through some of the most difficult and challenging situations imaginable. And I've got to ask you about your mental health. How did years of unmanaged pain and uncertainty contribute to depression, anxiety, or medical PTSD?
Yep, got all of those. Check, check.
I can only imagine, because
Yeah.
that's years of unmanaged pain.
And I can, compared to some of my other chronic illness friends, they're really suffering and have had to be inpatient for the psychiatric implications that come from
Mm.
their physical adventures in our healthcare system. But yeah, my pain is a big source of my depression. I actually started therapy again after several years yesterday. So
Excellent. Oh,
great.
that's great news.
sharing my story again. I was like, welcome to my TED Talk. So it takes a lot of work. I've
Yes.
tried all different kinds, CBT, and then I did a mindfulness-based stress reduction program through Hopkins. So it's really hard, especially when I remember when I was getting my spinal cord stimulator, I was at a hospital that I did not usually go to. And I remember being in pre-op and they were treating me so poorly that
Oh,
I was scared to be anesthetized. And that kind of PTSD, but those experiences have taught me that I just need to be very proactive and be like, okay, like anesthesiologist, what is our plan going in? What is our plan post-op? So just really kind of taking control and advocating for myself has helped me more in control of.
I think that's beautiful. Did doing things to take control of such an uncontrollable situation bring you any kind of mental, it just release and a sense of freedom?
Definitely, because I think I saw a social media post the other day that was something to the effect of living with chronic illness is married to the concept of uncertainty. Relate to that because you feel just so out of control and you find the smallest ways to regain control. And I think that's definitely empowering. But like I said, it's taken me like over a decade to realize, you can advocate for yourself. You can say, no, I don't want to do that treatment. Let me try this one or something like that.
Unfortunately, you've matured into this situation.
Right.
It started when you were so young. And it's no surprise that it's taken you some time to really develop the wisdom to manage this situation.
Especially women are really gaslit and
Yeah.
especially with chronic pain. So that's tough too.
yes.
Well, speaking of the pain, when you first met your pain specialist in 2022, you've said you were at rock bottom. And for the first time in a long time, someone said, I have more ideas.
Yeah.
And what did that moment give you emotional?
It was everything.
Oh,
When I couldn't sit up and just to be transparent, like I'm in a lot of pain right now, probably, 6 or 7.
oh,
I am able to sit up. When I first had my first virtual appointment with my doctor, I was lying down. I had sunglasses on. It was all dark because I have really intense light sensitivity. And I said, I've been told by all of these, best pain management doctors in DC that there's nothing else that we can try. And she said, I have so many ideas.
Oh,
Changed everything because having hope is even
yes.
more, oftentimes more meaningful and impactful than like the physical symptoms improving. So
Yes.
just the fact that she was like, oh, I have so many ideas. And so I've worked with her for, I think, going on 3 years now. And we've tried probably 20 medications over
Wow.
that time. And I'm like, why didn't these other people know about all these medications?
and have they worked?
Some, it's always just like
Trial and error.
trial and error. And yeah, like I increased one a couple weeks ago and it totally was was not good.
It's like mental health. A lot of
Yeah.
times the doctors develop.
Yeah,
It's not one thing or another, it's a combination.
exactly. She's just so, this is Dr. Tracy Speed at
I was going to
Johns
say, let's
Hopkins.
give her some credit.
She's the kind of person who I would consider naming my firstborn child after.
My goodness.
Just I don't think Ryan quite knows that, but she just has this very specific kind of cutting edge, think outside the box perspective. So a lot of the meds that we try are anti-seizure medications or antipsychotics. We're trying to kind of
So it's
rewire the
off label, but it's
Exactly.
working for what you need.
Yeah.
Yep.
Yes.
Beautiful.
Yeah.
And Hopkins has this special clinic. So
Mhm.
Meredith, let's talk about that so that our listening audience knows about this clinic at Johns Hopkins.
Yeah. It's called they call it because of this location, the Myers-6 program, or it's the perioperative personalized pain program, lots of P's.
Yes.
And so there's primarily an inpatient program, which I actually tried to get into for a couple of years, but insurance, because a lot of times pain management stuff is billed under behavioral health. And as we know,
I see.
behavioral health coverage is, much more difficult.
Yes.
Ultimately through like very kind of backdoor healthcare navigation gymnastics. I got to Dr. Speed and was able to see her on an outpatient basis. And I've been able to attend and speak at grand rounds when she delivered my case, and she actually delivered my case at, I think, last year's American Academy of Pain Management conference. And so I they really and she and her team really cares about presenting the whole picture and just looking at things differently, because all the people that come to them have, just like me, tried everything. And yeah, I'm just so thankful. I cry at the end of every
Oh,
winter just because I'm so thankful, and I'm like, darn it, it's happening again. But yeah, it's just that out of the box thinking and really personalized perspective that, they look at your history and don't just say, this is what the books say. So a lot of the times working with her, she says, there's no clear studies, research about this, but anecdotally, this is what I have seen.
Meredith, you're amazing. And I have such respect for you, and you're insightful. And it's just a beautiful conversation we've had. You've now founded Empower Health Strategies using your lived experience professionally. Why was it so important to turn pain and the realities of living with multiple chronic conditions into advocacy?
That's a question I could answer for hours. And to distill it, I would say, and so I primarily with Empower Health Strategies work with digital health innovators and clinical teams to help them better understand the real nuances and complexity of the patient experience so they can do their jobs better, which, benefits everyone. In the digital health space, that means helping them realize, okay, sure, in theory, these features or something make sense in your mind, but how do you talk to patients and realize that if you're creating something for dementia patients or people with limited cognitive capacity, this design is far too complicated, or kind of more like disease specific cultural things, like chronic illness people sometimes call themselves spoonies, and incorporate into your product's messaging to help them feel like, oh, you see me, you know what my experience is, and you've invested in understanding that. So I help create, kind of give advice and help with co-designing of products, of digital health products. And then also I teach courses and workshops for digital health founders to help them figure out how to really capture the full patient experience, patients' internal needs, external needs, interactional needs, contextual, so they can really understand. Like, just super quickly, I was helping a startup create a chronic illness like healthcare navigation, care management app. And in the onboarding, it was like, list all of your meds. And I pulled out my medication basket and I was like, with my 20, 30 medications, I was like, this would take me 2 hours, and I would immediately delete that app. So just things like that, kind of, showing this is what it's really like. This is why this won't work, but maybe this will work. So I just love kind of those aha moments when founders and engineers or clinicians are like, I had no idea. So I just love kind of helping them realize that after courses that I've given. I've gotten LinkedIn messages from these important doctors being like, thank you so much. I never knew this.
oh,
It's
Same way.
beautiful.
So it's been really rewarding.
Meredith.
And you must feel totally empowered.
Yes. And that's why I named it that way. Is like I empower
Yes.
innovators to empower patients.
That's exactly what it is.
Yeah. Thank you for asking me about that.
Meredith, I want to thank you so much for joining us today and sharing your story. It's a really
Absolutely.
it's a complex story, and it's a complex story about pain, which not everybody really has an experience with, but which you have so eloquently described. And Meredith, you have taken this struggle and you've moved beyond it by going to advocacy, and your advocacy is going to help so many people. Meredith, I hope that the joy that you feel from your advocacy will be with you forever, because you deserve all the accolades that I and Kathy, that we can bestow upon you. You
Absolutely.
you are a remarkable young woman, and it is an honor to be with you today. Thank you so very much for joining us.
Thank you for being on It Happened to Me. I mean, you have been just an extraordinary guest. Thank
you. And I want to say thank you for creating this space and platform for patients to share their journeys, because it's so impactful. So thank you both.
Thank you for listening to this episode of It Happened to Me. We encourage you to learn more at ithappenedtomepod.com. Please use the contact form on our website to submit your guest suggestions, comments, questions, ideas, and feedback for the show. You can also email us directly at ithappenedtomepod@gmail.com. We would really appreciate it if you can leave us a 5-star rating and review on your podcast app like Apple or Spotify. This helps others in the rare disease and medical challenge community find us. It Happened to Me is created and hosted by Kathy Gillenhorn and Beth Glassman. I'm Keira Deneen from DNA Today, and I serve as our executive producer and marketing lead. Amanda Andrioli is our associate producer. Ashlyn Anokian is our graphic designer. And remember, it happened to me. I'm not alone, and neither are you.